Imagine experiencing stroke-like symptoms, sudden weakness on one side of your body, trouble speaking, and vision changes, only to be told it's not a stroke, but a rare type of migraine. Hemiplegic migraine is one of the most complex and alarming forms of migraine, often misdiagnosed and misunderstood. In today's video, we'll explore what sets it apart, what causes it, and how it can be managed. What is a hemiplegic migraine? A hemiplegic migraine is a rare and severe form of migraine that includes temporary muscle weakness or paralysis on one side of the body. This weakness typically occurs during the aura phase, which can begin just before or at the onset of the headache. In addition to motor symptoms, patients may also experience sensory disturbances, visual changes, and difficulty with speech. What are the types of hemiplegic migraine? There are two recognized forms of hemiplegic migraine, classified based on their underlying cause. Familial hemiplegic migraine. This type is inherited and runs in biological families. It is linked to specific genetic mutations, with 3 known subtypes categorized by the particular gene involved. If no identifiable mutation is found, it may be labeled as familial type 4. Sporadic hemiplegic migraine. This form occurs in individuals without a known family history of the condition. Despite the absence of a genetic link, the symptoms and clinical course are similar to the familial type. Is a hemiplegic migraine a medical emergency? While a hemiplegic migraine itself is not considered a medical emergency, its symptoms can closely mimic those of a stroke. These may include sudden muscle weakness on one side of the body, visual disturbances, and impaired speech. Because of the overlap in presentation, it is essential to seek emergency medical evaluation immediately if you or someone around you experiences these symptoms. Distinguishing between a migraine and a stroke requires prompt professional assessment, and time is critical in the case of a true cerebrovascular event. How common is a hemiplegic migraine? While migraine headaches are relatively common in the general population, hemiplegic migraines are considered rare. Data from a study conducted in Denmark estimates the prevalence to be approximately 1 in 10,000 individuals. What are the symptoms of a hemiplegic migraine? Hemiplegic migraines typically present with both classic migraine symptoms and additional neurological signs that distinguish them from other migraine types. These symptoms may include muscle weakness or paralysis affecting one side of the body, visual disturbances such as blind spots, flashing lights, zigzag patterns, or double vision, numbness or tingling sensations in the face, arms, or legs, difficulty speaking or forming coherent language, profound fatigue, mental confusion, or cognitive slowing. These manifestations usually occur during the aura phase, just before or at the onset of the headache. The symptoms may last for several hours to a few days and, in rare cases, can persist for up to 4 weeks. In most instances, symptoms resolve completely without permanent neurological damage. What does a hemiplegic migraine feel like? The hallmark of a hemiplegic migraine is a severe, throbbing headache that is typically accompanied by noticeable one-sided muscle weakness. A simple test such as raising both arms may help reveal this weakness. The affected arm may feel unusually heavy or be difficult to lift and hold in place. What causes a hemiplegic migraine? The underlying mechanism is thought to involve abnormal nerve activity in the brain, a phenomenon known as cortical spreading depression, an electrical disturbance that moves slowly across the cerebral cortex, disrupts the normal function of nerve cells. This event alters the electric charge across neurons, impairing the transmission of signals and leading to the characteristic symptoms of hemiplegic migraine. Genetic mutations are known to play a significant role in this condition. The following genes have been identified in individuals with familial and sporadic forms of hemiplegic migraine. CACNA1A, associated with familial hemiplegic migraine type 1. ADP1A2, associated with familial type 2. SCN1A, associated with familial type 3. PRRT2, implicated across various familial types. It is important to note that research is ongoing, and additional gene variants may yet be identified in connection with this rare neurological condition. What triggers hemiplegic migraines? The triggers for hemiplegic migraines often mirror those associated with other types of migraine disorders. These triggers can vary widely from individual to individual, but commonly reported factors include emotional or physical stress, disruptions in sleep patterns, including insufficient or excessive sleep, physical exertion or intense physical activity, head trauma or injury, exposure to bright or flickering lights, certain dietary factors, including specific foods or skipping meals. In rare instances, hemiplegic migraines have been reported to follow a cerebral angiogram, a diagnostic imaging procedure used to evaluate the blood vessels in the brain. When do hemiplegic migraines typically begin? Hemiplegic migraines most commonly begin during adolescence, typically between the ages of 12 and 17. While the frequency and intensity of these episodes can vary, many individuals report a reduction in both severity and frequency as they age. What are the possible complications of hemiplegic migraine? In the majority of cases, symptoms of a hemiplegic migraine resolve within a few days. However, in rare and more severe presentations, symptoms may persist for several weeks. These prolonged episodes can significantly affect an individual's quality of life by disrupting academic, occupational, and social functioning. Although severe complications are uncommon, they can include seizure activity, short-term or long-term memory impairment, alterations in personality or behavior, delays or difficulties in cognitive development, particularly in pediatric cases, challenges with speech and motor skill acquisition in children. In extremely rare cases, coma. Due to the overlap in symptoms with more serious neurological conditions such as stroke, any new or worsening symptoms should be promptly evaluated by a healthcare professional. How is a hemiplegic migraine diagnosed? Diagnosis of a hemiplegic migraine begins with a comprehensive medical evaluation, including a physical and neurological examination. During the assessment, your healthcare provider will gather a detailed history of your symptoms and inquire about any family history of migraines or related neurological conditions. If you have biological relatives who experience migraines, particularly hemiplegic migraines, be sure to communicate that to your provider. To rule out other conditions that may present with similar symptoms, such as stroke, epilepsy, or multiple sclerosis, your provider may order several diagnostic tests. These may include genetic testing to identify mutations commonly associated with familial hemiplegic migraine, computed tomography, CT, scan to evaluate for structural abnormalities in the brain, magnetic resonance imaging, MRI, to assess soft tissue and detect any signs of brain lesions or abnormalities, lumbar puncture to analyze cerebrospinal fluid and exclude infections or inflammatory conditions, electroencephalogram, EEG, if seizure activity is suspected. These tests help ensure an accurate diagnosis and guide appropriate treatment. How is a hemiplegic migraine treated? Treatment for hemiplegic migraine is individualized and may include both acute and preventive strategies. Your healthcare provider may recommend or prescribe one or more of the following medications. Antidepressants such as tricyclic antidepressants or serotonin norepinephrine reuptake inhibitors, SNRIs, which can help reduce the frequency of attacks. Antihypertensive medications, including beta blockers or calcium channel blockers, which are commonly used in migraine prevention. Anti-seizure medications, which stabilize nerve activity and may reduce migraine episodes. Calcitonin gene-related peptide, CGRP, antagonists or botulinum toxin injections, depending on the specific clinical presentation and patient response. Your healthcare provider will discuss the potential side effects and dosing schedule for each medication. Regular follow-up is important to assess effectiveness and make adjustments as needed. Can a hemiplegic migraine be prevented? While it is not possible to completely prevent all hemiplegic migraines, certain measures can significantly reduce their frequency and severity. Preventive medications may be prescribed for long-term management. These are typically taken daily and adjusted based on your symptoms and triggers. In addition to medication, identifying and avoiding individual migraine triggers, such as stress, lack of sleep, dietary factors, or environmental stimuli, can play a crucial role in prevention. Your healthcare provider can help you develop a personalized migraine management plan, which may include both pharmacologic and lifestyle interventions. Hemiplegic migraine can be frightening, both for those who experience it and for their loved ones. But with the right diagnosis, ongoing care, and a clear understanding of triggers and treatment options, it's possible to manage this condition and reduce its impact on daily life. If you or someone you know is facing symptoms like these, don't hesitate to seek expert medical advice. Awareness and early intervention make all the difference.